ready, Andrea?
Yes, I am.
All right. Good afternoon, everyone. I'd like to call the Cuyahoga County Health and Human Services and Aging Committee to order. Today is Wednesday, October 20th, and it's 1:01 or 2. Can you please call us to order?
Yes. Good afternoon, everyone. As a reminder to all in attendance, this meeting is being recorded and live streamed on the county YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney is absent. Ms. Brown.
Here.
Mr. Miller.
Here.
Ms. Stevens is absent. You have a quorum.
Thank you. I'd like to excuse both Sweeney and Councilwoman Stevens from the committee today, even though it's not required. Is there, that's a motion? Thank you. Moved and seconded by Brown. All in favor, please say aye.
Aye.
Aye. Anyone signed in for public comment, Madam Clerk?
No public comment has been submitted, Madam Chair.
Moving on, I'll make a motion to approve the minutes from our October 6th meeting. Is there a second?
Second.
Okay, it's been moved and seconded by Miller. All in favor, please say aye.
Aye.
Aye. All right, minutes have been approved. I believe we have one item referred to the committee today, and Madam Clerk, if you could read that into the record, please.
Yes, Resolution 2021-0237, authorizing an amendment to a master contract with various municipalities and providers for various services for the Community Social Services Program. It's for the period January 1st, 2019 through December 31st, 2021, to remove Elder Care Services Institute, LLC, effective November 9th, 2021, and for additional funds in the total amount not to exceed $600,000 for items 1 through 26 as listed on the agenda.
Thank you.
Good afternoon, David Merriman, Director of Health and Human Services. I'm here on behalf of the Division of Senior Adult Services. Director Tracy Mason is not in the office this week, so what I'm going to do is I'm going to turn the presentation over to Daphne James from the Division of Senior Adult Services and Paul Porter. I'll ask Paul first to present the item and share the details of the request, and then Daphne is here to answer any programmatic questions. Paul?
Thanks, David. Afternoon, council members. This is an amendment to the DSAS Community Social Services Program. These are the funds that DSAS puts out throughout Cuyahoga County to fund senior center-based services. This is separate from DSAS's Options Program, which funds more in-home services for seniors throughout the county. We're adding funds to get us through the end of the current contract, which ends 12/31 of this year. As you know, there have been changes to the way senior centers deliver services as a result of the pandemic starting last spring. These additional funds acknowledge that new reality by helping to make sure senior services can continue to deliver services in kind of the hybrid model they've been using largely since June of this year, when many of the centers resumed in-person programming. We're trying to acknowledge that even though in-person programming has resumed in some areas, senior centers are still doing home delivered meals. They're still doing virtual programming. There may be some seniors that are coming in to pick up meals or to have meals at a senior center, but especially with the increase in cases starting in the late summer, even some of those seniors kept at home, while case numbers were still pretty high. I'd also like to say that in addition to this $600,000, we're winding down the RFP process for a new master agreement that's going to start January of next year. And we tried to take some of the lessons learned during the pandemic about that hybrid service model and what was working for centers over the past year and a half and include that in our RFP. Previously, this funding was all about, congregate services in centers. So adult development, group activities, congregate meals at a center, group transportation to and from the center, things like outings and field trips. At this point, we're ensuring that funding for next year includes not just those congregate meals, but home delivered meals as well, so that seniors that have either continued to receive services this way if they were previously attending a center, or some seniors that have been identified during the pandemic that maybe weren't coming out for services in the community, but those senior centers are doing outreach in the neighborhoods and identifying seniors who'd be interested in a home delivered meal or virtual programming. We're trying to account for services to those individuals. There is a breakdown in the agenda of the specific amount of additional funds and what services those additional funds are for each center. I'm happy to answer questions about those, but I don't want to take your time and review those all word for word. The amount does add up to a total of $600,000, and we anticipate that this will be the final amendment to this master agreement because it ends on December 31st. A quick note about Elder Care Services Institute. That's the adult day program that was being run by the Rose Centers for Aging Well and Benjamin Rose Institute. They already had a fairly low client census prior to the pandemic. And during the pandemic, it's such an intensive level of service. The adult daycare is more, for individuals that can't move around on their own, for instance, and might need one-on-one help to participate in services. They opted to halt that programming. That's why they're being removed from the contract with this amendment. And I'm happy to answer any questions you might have.
Thank you, Paul, and that was one of mine. Why was the removal of the elder care services? So very well put. Are there any changes in the body of the master's contract from the previous contract?
No, this is just additional funds and then removing the vendor. There's no scope change at all as part of this amendment. You might recall the last amendment we did. We made the scope change to allow for the modification of service delivery as a result of the pandemic. There are a couple of vendors that are getting new services as a result of this, that maybe they weren't delivering those services before. And let me just consult my notes to make sure I give you an accurate description of that. Daphne, do you want to refresh my memory on who specifically? I think it's 2 vendors that are delivering new services as a result of this.
So we had,
State your name for the record.
I'm sorry, Daphne James, Division of Senior and Adult Services. This is black and white. I had them in red. So we had 2 providers. One of the services was adult development, and another was transportation. I can't tell which is red.
Phyllis Wheatley has transportation.
Yes, Phyllis Wheatley
And
and
then
Maple Heights. Maple
has
Heights was adult development, and Phyllis Wheatley, 10,000 for transportation.
And both of these providers have provided in the past. This is just additional, correct?
No, these are new services for
Just
them,
new,
yes.
new services that they've never, okay, but we've had them for other services.
Correct, they're
Okay.
current providers.
So Phyllis Wheatley and Maple Heights was the,
2 that are having additional services, yes, and that's Maple Heights is getting $7,000 for adult development, and then the Phyllis Wheatley Association, which had delivered just meals before, is getting transportation in the amount of $10,000. Thank you, Daphne.
okay, so that transportation, I'm assuming, Paul or Daphne, that it is to get the home delivered meals or for them to pick them up?
It involves delivery of meals as well. We allow them an opportunity to deliver meals and submit for transportation. Mainly since some of the centers have opened up and both of these have opened, it's transporting clients.
Okay, back and forth to the center, okay.
That could include, Councilwoman Conwell, back and forth to the center as well as other transportation. Some of the centers do, field trips and outings, as well as one-on-one transportation if, for instance, a senior needs to get to the grocery or the doctor's office or something like that.
Okay. Okay, so I think you've answered all my questions. I had, any of the providers in 2020 requested additional funds, so it was just these two? Because they're offering new services, or were any of the others requesting any additional funds for the services that they already provide?
The entire spreadsheet, this is all additional funding. Those were, what we just spoke on was funding for new services, but the entire spreadsheet is requesting additional funding.
Okay, thank you.
Madam Chair.
Councilman Miller?
Is this additional funding that hasn't previously been appropriated?
That's a good question.
Councilman Miller, I do believe that these are funds that were appropriated within the DSAS budget and were moved into the Community Social Services Program in order to meet the demand for these services. So it wasn't part of CSSP originally. It's additional funds on top of the initial allocation. I will note that for next year, with the RFP and the contract that we're submitting for next year, this $600,000 figure is included in the budget for CSSP for next year.
And where was this money taken out of to make this appropriation possible?
Money was awarded to DSAS in the end of December 2020.
So this was part of the mid-year update? But was it awarded specifically for this program? It was, okay. And are the additional dollars by agency determined by an assessment of what the demand was for each of these programs in the various agencies?
Absolutely, and it also included feedback from the providers as well.
And as I recall, the Gun and Recreation Center has been funded under this program in the past. What happened to them?
Councilman Miller, Gunning is one of the sites for Rose Centers for Aging Well, so it's not recorded separately on the sheet, but there is an additional allocation for Rose Centers for Aging Well that's included on the agenda at the bottom of page 3. And that's because they have multiple centers, that funding could be spread across, different centers. It's not specifically allocated just for that center, but the Gunning Park location falls under Rose Centers for Aging Well.
Okay, thank you.
And I don't know if it would be too much trouble, but in going forward, if you have some like Rose Centers and Catholic Charities that are not spelled out individually, if you can just include who they cover, so we'll know.
Absolutely, we can make sure to do that. Again, because all of theirs is funded under one line, we allow them, if one center is utilizing more than another center, to bill us based upon the utilization. So in our award, we don't specify the dollar amount per center, but we can let you know which ones are included in that.
Okay. Any other comments? Councilwoman Brown?
Thank you. I just wanted to get a point of clarification on the Phyllis Wheatley additional funds. I didn't see it itemized in the contract, so is that included in the 38,000 or is that somewhere else? I could be missing it.
Correct. That is included in the 38,000. The way we have it allocated is 28,000 for meals and then 10,000 for transportation. The way it is in the agenda, we just have the overall dollar amounts that each vendor is getting additionally. But Phyllis Wheatley's breakdown is the 28,000 for meals and 10,000 for transportation.
Okay, and thank you for that. And I see, this is more of a technical question in nature. It looks like agreements are applied to municipalities versus contracts are applied to agencies. Is there any specific reason for the distinction?
I have to say, I think that's a distinction that maybe either the law department or the Department of Purchasing makes based on what the legal document we're using to enter into it is. However, since it all falls under one master agreement, it's still one document. It's just referred to differently for municipalities versus, the other vendors that we have, the majority of which, all of which are nonprofits aside from municipalities.
Okay, perfect. And then the last thing is, I'd just like to add my name. So with that, happy to move this forward under second reading suspension if there's no objection from the chair.
Right. Paul, is there any changes in the vendors other than the elder care services?
No changes in the vendors, Councilwoman Conwell.
All right, and the master's contract for the new RFP will be in January 2022. Is that for 3 years or 2?
We're looking at a 2-year term to start with, but then there would be an option year for the 3rd year. So the RFP was for 3 years. The initial contract will just be for 2.
Okay, I know that was different. And of course, you want this for second reading suspension?
If we could, please, because this is effective upon approval, it would be good to have it approved on the second reading. Thank you.
All right, any other things you would like to add, you or Daphne, in regards to any of these, this master contract?
No, well, yes, actually, when I reached out to the providers, like I said, we were looking at their utilization, and we also took into consideration how they, what their requests were, how can I say that? And based upon their request, the pickup with, opening the centers and then partially doing the hybrid, it's really helpful. They're really excited about it. It allows them to continue their operations and sustain their organizations.
Okay, in the utilization of services and with this hybrid model, are we having any of the seniors reach out to us that have an issue with the ones that are coming to the center? Is it a issue due to broadband services or access to Wi-Fi? Are we connecting with them and seeing if that's an issue?
So they have been very creative in how they have been delivering their services. Many of the providers are offering virtual services, whether it be through public broadcast. Some of them are offering support in regards to utilizing the technology, but not on the level we would like. They're doing the best they can.
So there may be some seniors out there that don't have access or have the Wi-Fi or...
Absolutely, and part of this also is they were doing wellness calls and connecting with the seniors, but this is also why we made it as part of our strategy for our new CSSP contract to deal with the digital literacy.
Okay, so you have a provider that's on here that's gonna...
For the CSSP, for the 2022 contract, yes.
Okay. Yeah, because I'd like to, if we could capture that, if we're going in the homes or having connections to find out, since we're moving that way, to assist and get them.
One of the things, if I also may say, is we continue to survey. We're sending out a survey probably in the next week to our CSSP providers, which is very important because they've been at home, and that is how we get their feedback. We can't call all of them. And of course, we don't just, we report the good, you'll hear about that, and we do something about any challenges or whatever, we do reach out.
Councilwoman Conwell, I will make sure when we're back to present this contract for next year that we include a couple of examples of client feedback on that survey Daphne just mentioned. Some of the stuff that we read, particularly during the pandemic, really highlighted the value of these centers even when they were closed in the lives of these seniors. Part of what we're trying to do with that new award, not just, addressing the digital divide, but including community outreach as a service, which isn't something that's been funded under this before. But what we found and what centers found when they were trying to connect with seniors while their doors were closed was that just calling somebody, like Daphne said, or bringing a box of activities and food to their house, for instance, was a critical lifeline when folks were cut off from their usual, community environment that they would go to during the pandemic. Even as COVID hopefully subsides at some point, that's the kind of community outreach for these centers that we want to see them doing to engage clients that are already in their neighborhood, but also to make sure, as people within their neighborhood age, that they are proactively reaching out to include them in service delivery. And that's really an area that we knew senior centers were providing those services to some degree before, but it wasn't part of our funding. You'll see that that new contract acknowledges that that's something that we want to fund to make sure we're reaching as many seniors as possible with these dollars that we're investing in the community.
I'd also like to say is what these additional dollars did, under normal circumstances, you see the same clients in and out of the centers. We encourage them to reach out to the community. We know we're not serving all of the seniors. So they brought in more seniors into their network, which was a wonderful thing. Maybe these people will participate, once the community opens back up. But that was a big thing with them opening it up to not just the people that were there already. And the goal was to not turn anybody down, especially for a meal. So the number of clients that we service has increased. I don't have that number. We're working on our end of the year numbers right now.
You'll just let us know via email with it. Sounds good. It's like a win-win. And everybody was healthy and safe. Any other further questions from the committee? All right, hearing none. Thank you, thank you. I know you want this second reading suspension. I believe Councilwoman Brown made a motion, and I'll second it. So all in favor of moving this to the full council under second reading suspension, please say aye.
Aye.
Aye. This contract has been referred to the full council, and I thank you both for coming out.
Thank you.
And I don't think there's anything else. Any miscellaneous business, not seeing any or hearing any. So this committee is adjourned.